When I saw this on your site, it blew my mind. A 90% risk reduction in the healthcare sector, as you mentioned before, for a Texas hospital. I'd love to hear more about that application.
Yeah, absolutely. We're really proud of that. Again, hospitals being a real focus of mine because of the risks there. We have a comprehensive full stack solution here. We don't just protect one or two parts of the system and make them buy 10 things. They can come to ActZero as a one-stop shop and get defense for their whole business. For example, we will install some software on the laptops that looks for the signals of ransomware attack happening. Listen, it's good to train people not to click on the link, but people make mistakes. And with AI, as you mentioned, it's getting harder and harder for good people to defend themselves against these kind of impersonation attacks. You need tech on the computer that knows what actual cyber attack signals are. You can't just rely on the people typing away. We also provide similar software for the phones, as I mentioned. iOS, Android, Chromebook. Interestingly, a lot of hospitals are starting to give doctors like a little pad to walk around with, see all their patients in all the rooms. They don't have to log onto a computer in every single room. They can walk around with a handheld device. Those are risk factors. We install software on that too, just like the phones. The network, heard of firewalls and intrusion prevention systems. We plug into that and see all the attacks coming in from overseas and data leaving. We plug into your cloud and email accounts. So if you're, texashospital.com, you're logging in there. We're plugging into that email and the cloud backend so we can see when people are trying to hijack those email accounts and sneak in. You can see the account takeover, we call it, and block that. We plug into identity systems like Okta that you log in through, again, to try to block people from impersonating your accounts. So we're covering all the things that a hospital has to worry about here. Also doing vulnerability scanning, also doing human threat hunting, other things you need to do to make sure you didn't miss anything. And, at the end of the day, hospitals really reduce their risk, right? Laptops now secured, phones now secured, firewalls now monitored, cloud and email now secured, all the way from the junior intern to the CEO of these businesses covered by us. So when you add it all up and you look at the total risk they had, we see dramatic reduction. Number of alerts and false alarms they used to have to respond to, dramatic reduction. Their cyber insurance premiums that they pay their insurance company also go down because we've lowered their risk. They showed that to the insurance company and they have less costs to pay there too. And of course, at the end of the day, number of cyber attacks. Far lower rate of successful attacks when you've got ActZero, almost zero. And, that's saving them money in the ransomware payments they would have had to pay. Last thing I'd say is just IT guys' time. Some of these bigger hospitals do have an IT team. We're doing the security, but they still can't handle the IT. They got a lot less work to do. They don't have to deal with cyber attack warnings and false alarms all the time because we've kind of taken that off their plate. And so they're much happier with less security stuff to worry about so they can focus on their own, hospital IT going forward.